The Royal College of Surgeons says the record number of patients waiting for hospital treatment in England shows the calamitous impact of COVID-19 on the NHS. Almost 4.5 million people in England were on lists at the end of November before this latest lockdown, many of them for routine operations like hip replacements. But some cancer patients are also now having to wait. It comes as more than 1,200 deaths were reported in the last 24 hours. Here's our health editor, Hugh Pym.
The consequences of coronavirus are becoming clearer. Queen Elizabeth Hospital in Birmingham temporarily halted its kidney transplantation programme because of the surge in COVID patient numbers. Other hospitals are also postponing non-COVID work. Paul and his wife Diane are both living with cancer. Her treatment is going well, but he needs specialist radiation therapy for a rare tumour in his chest.
I used to run a lot, but now I get out of breath just going up the stairs.
He was set to have it last week, but was told because of COVID pressure at the hospital it had been cancelled.
I was devastated. I couldn't speak for 10 seconds when they told me on the phone. You know, it's not just devastating for me, it's my family and friends. I know, they've been rooting me for the last 12 months. You know, I've got this tumour and I've had it for at least 12 months. It's frightening. It's frightening.
Cancer charities say that sort of cancellation isn't happening yet at most hospitals, but they're worried it could do.
There was a huge effort made to restore cancer services to pre-pandemic levels, and massive efforts gone into that. But we are concerned now, in this lockdown, that there's going to be increased pressure on services, and we fear more treatments will be cancelled.
For routine hospital treatments such as hip and knee replacements, in England in November, more than 192,000 were waiting. To give a sense of scale, that's about 3 times the capacity of London Stadium, home of West Ham and where the Olympics were staged. By contrast, in February, just before the pandemic, the figure was only about 1,600. That's below the capacity of non-league Margate Football Club Stadium. NHS England said that unlike the first wave, millions of people were being treated in hospitals for non-COVID health problems. Government sources said waiting lists were still a lot lower than some earlier predictions. But there's no doubting the COVID pressure on the front line, including here at York Hospital.
I'm worried that we're getting very close to the kind of scenarios that we're already seeing down in London, where hospitals have breached the capacity, even for their surge capacity for COVID.
The hope is that widespread vaccination will reduce patient numbers in hospitals. And from today, jabs are being delivered in some pharmacies in England, adding to GP hubs and other sites. So how's the vaccine rollout in England been going? Well, up until last Sunday, around 46% of the 80 and over age group in the northeast and Yorkshire had had their first dose. In the northwest, it was 38%. In other regions, a little bit below that. In London, it was closer to 30%, and in the east of England, it was a bit lower than that. As a percentage of the whole population, Northern Ireland is ahead of the rest of the UK, with more than 5% having jabs. Wales has the lowest so far at about 3.5%. But these are early days. Hugh Pym, BBC News.